All right, let's put this rising COVID-19 numbers into perspective. And joining me now is Dr. Githinji Gitahi. He's the CEO, AMREF, and also a member of the COVID-19 task force team. Dr. Gitahi, thank you for making time for us. What can we attribute these rising COVID-19 numbers to? Doc, unmute your microphone, please.
Yes, there I am now. Thank you,
Yes.
Trevor.
Yeah.
So the ministry had said, and other experts had said that the fourth wave we had was not the last one. We're going to see another wave because until the virus burns out, or we are going to keep getting these waves. I think the real question is, as you asked, what's causing this? It is just another wave, like the fourth one. But then, obviously, as the waves come, and we had actually seen that a wave will come somewhere in December. It's come a little earlier, but it's also mixed up with a new variant that has been noticed across the world, called Omicron, and which is known to be more transmissible. If you look at the curve now, it's very steep, unlike the other previous curves. So that's what is driving it. It's a new variant, but it's also expected. It's not like if the new variant didn't come, we would not have a wave. We would still have had a wave.
So can we confidently say this is the fifth wave, and are we likely to experience a sixth then? And is there an end to this?
Yeah, you're likely to experience a sixth and a seventh and an eighth. I think these pandemics have a long tail, and normally they'll become endemic after that because this particular virus has just met a new host. That's the human host, and is now, kind of developing itself to learn how to live with this new host. But the host is also developing their own immunity to fight this virus, and until you reach a balance. And when you reach that balance, then the virus becomes endemic, meaning you live with it without any negative, impact on your body, like a common cold, and other coronaviruses. Yeah. So I think the most important thing here, Trevor, is that when we get vaccinated, then it's likely that this endemic stage will be reached much faster. And therefore, it doesn't matter whether you get infected as long as you're not going to get severe disease. Yeah,
well, so what options should the government be mulling at this point? Because I saw a tweet from you earlier on saying just the rising infections without signs of increasing hospitalization in the health system are not a reason for curfew, which is actually a trending topic right now on Twitter.
Yes, because you see, the reason you do curfew, lockdown, and all these things, it is to protect lives and protect the health system. Remember that originally when we started talking about COVID, we're talking about flattening the curve. And we did explain that you flatten the curve so that it doesn't overwhelm your health system with sick patients, and then your health system is unable to save those people. That's the reason for this attempt. So if you think that the rising wave is putting people at risk and the health system is not able to provide them the care they need, then you put curfew, you put a lockdown, you do all these measures to reduce the wave and reduce the force of transmission, so that you give your health system a chance to save those people who are unwell, and you reduce the infection rate. But if there is only infection, but you're not seeing rising hospitalizations, then why do a lockdown? Why do you want to do a curfew? You just manage, do the test as many as possible to isolate people, wear their masks, they socially distance, but then you monitor the hospitalization. That's really what you need to do.
So you don't think this is the time for a curfew or even a lockdown then?
No, I don't think so. Why would you do it? We are not seeing hospitals filling up. So why would you actually? We've not seen signs. What we've seen, Trevor, if you talk to different hospitals, is that the outpatients are packed. We are seeing double the numbers of people in the outpatient department. Many people are having mild disease. They're going there. They have some chest problems. They have muscle pain. They have all these things. They are tested. They're positive, but they don't require admission. So the outpatients are full, but the hospitals are empty. If you look at the COVID isolation wards, you'll actually see that there are no people admitted there. Then why would you then do a lockdown? What are you protecting? Yeah. Because the health system, is still ready and empty.
Yeah, guys, people who are pro-lockdowns and curfews are arguing that there's some level of laxity when it comes to taking precaution against COVID-19. We don't see people wearing masks as much. We don't see people sanitizing as much. And isn't that a reason, or should the government just think of other ways of ensuring people adhere to the precautions and the set procedure and standards?
See, the most important thing is to make sure that, because even if you have a virus or a variant like Omicron that might have a lower rate of severe disease, you don't too many numbers, because then a small percentage of a big number can also overwhelm the system. So it's important, as you're saying, that the government reiterates through community structures, through community health workers, religious leaders, that people need to continue to obey these rules. And that is what is going to save other people who may be along the way if these infections go too high. That's important. But the most important thing we are seeing also, that people who are vaccinated are less likely to get severe disease, less likely to be admitted, less likely to require oxygen. So the biggest tool and the best tool is get vaccinated, and now the vaccines are available everywhere. Get vaccinated, take advantage of this festive season, get vaccinated. Then you don't have to worry too much, all of us, about putting lockdowns and curfews in the future.
What are the models predicting from what you've seen in the past and what is going on now? Because we seem to have flattened the curve at some point. Now we're on the fifth wave. What are the models predicting? What should we expect going into 2022, considering there'll be large gatherings as the election year comes in?
You see, if you look at data from the previous waves, and you look at both infection rate and hospitalization rate, they almost map each other. The hospitalization rates were up to 25% of the people positive. Sometime it was even up to 36% of the people who are positive. Right now we are seeing hospitalization rate around 10% or less. And this data is not only for Kenya. We've looked at data for South Africa, there's data for other countries as well, that actually shows that hospitalization rate is not matching the very high positivity rate. So we need, obviously, not to take this message to say, therefore, it doesn't matter. Because a lot of people infected could mean a lot of people, even if it's 10%, could be a lot of people in hospital. But also remember that Nairobi, which is now kind of where you'd say is the epicenter of this wave, and Kiambu and the environs, have also very high vaccination rates. Nairobi has almost 40%. In Mandera, you have 2%. In Isiolo, you have, So you also have to remember that this high vaccination rate in Nairobi could be affecting the rate of hospitalization. And therefore, we have to be careful because the virus could behave differently if it is actually rolling so rapidly in a population that's not vaccinated as Nairobi and Kiambu are.
Yeah, there are theories that are coming up and down. Some people saying it's the weather that's aggravating this because it's a cold season. Is there any evidence to that?
You see, all these things that you can actually hypothesize them, and you can say that being a respiratory virus, then the conditions that result in respiratory infection may actually enable it to spread faster. Because you can imagine you're wearing a mask, but you have a cold or you have a flu or something. You have to keep removing your mask to blow your nose. When you blow your nose, you may not always sanitize. Then you have the handkerchief. So if you had the viruses, it's very likely that somebody who had another underlying respiratory condition, like a common cold or an influenza, is more likely, if they also have COVID, to spread the COVID than somebody who did not have that underlying respiratory condition. So it's likely that the respiratory conditions, either influenza, as was said, influenza A, or whatever it is, could also be creating the right environment for the Omicron, or whatever variant that's spreading, including Delta, or whatever it is, to actually spread faster. Yeah. So they can play on each other.
Okay. Doc, the death toll is not as high as what we saw in the second wave. Does that mean that the people are more resilient now?
So I would like to talk about hospitalization rather than the death toll, because we have seen actually, the death, we don't have a death toll to speak about right now. Of course, we don't want to lose every single life matters. The first indicator, because of course this is very new, remember that we don't have more than 3 weeks of this new wave and this new variant. So we have to wait, and there's always a lag. But at the onset, the key indicator is hospitalization. We start to see hospitals filling up. We start to see ICUs filling up. We start to see people asking for beds. And we monitor hospital data, and you can see that's not going on. So there are two factors that could be. One is that the virus itself could be presenting with very mild symptoms that are resulting in outpatient visit but not hospitalization. But the second one is the condition of the host, the individual themselves. If people already had exposure before or they have been vaccinated, then they present a hostile environment for the virus. So it's two conditions, the virus condition and the host condition.
Doc, should we consider a booster shot for those who've been vaccinated?
This is now a debate. Of course, we know, let's talk about science. Science says that yes, there is the possibility that a booster shot gives you higher protection, and a booster shot may help you against new variants as well. But we know that a booster shot, or even the primary vaccination, the two of them, still give you adequate prevention against severe disease. So the question then is to ask, if you have a booster shot to give, would you rather give it to somebody who doesn't have any primary vaccination? Because then the benefit of giving that one shot to somebody who has no vaccination is much better than giving it addition to somebody who is already fully vaccinated. So it becomes a moral question. But scientifically, booster shots, or third doses that they are being called, will give you some extra immunity. That is not debatable. It is a moral question. So the question is, when do we start booster doses? That's the question, and for who? Now the conversations are that if we have enough adequate doses, we should introduce them for the elderly and those who have a condition that stops them from developing adequate immunity. So very selected groups, not generalizing it.
All right.
That's a discussion, not yet a policy.
All right. Thanks, Doc. Dr. Githinji Gitai, there is a group CEO for Amref Health Africa and also a member of the COVID-19 task force, putting this into perspective.